changes for 2024. We're going to cover right now. The Inflation Reduction Act of 2022 includes several provisions that will lower Medicare Part D costs, lower prescription drug costs, $35 a month cap on insulin, $2,000 yearly cap on out-of-pocket costs. This is going to start in 2025. We're building up to that. Negotiating drug costs, limited price increases to inflation starting in 2025. Expanded access to preventative care, cancer screenings, and vaccines. Financial assistance for low-income beneficiaries. The LIS program, or Extra Help, has expanded eligibility, increased LIS financial assistance. So that's great news there. Potential for skyrocketing Part D premiums. So nobody really knows, carriers, anybody I've talked to, and I talk to, this is my job, right? I help brokers as well as customers. Nobody really knows what 2025 is going to bring, and a lot of companies are getting nervous. Some are saying there may never be another $0 premium again. We don't quite know the ramifications of this until we get closer to 2025. So as great as that sounds, it's going to reflect on plan premiums. Again, speculation at this point. Drug manufacturers required to pay rebates to the government if prices for certain drugs increase faster than inflation. Drug manufacturers may increase drug prices for other drugs to offset the cost of the rebates. 5% co-insurance requirement for catastrophic coverage eliminated in 2024, which we just went over. Beneficiaries who use a lot of expensive drugs may have higher Part D premiums. Most of us, if not everyone out there, is going to probably experience that, unless the premium is getting paid by the state or an LIS or Medicaid or something of that nature. I could definitely would say expect premiums to go up in 2025, but we'll take it 1 year at a time. Overall impact, mixed impact on Medicare Part D costs for beneficiaries. Could lower prescription drug costs and expand access to preventative care. Could also lead to higher Part D premiums for some beneficiaries. Full impact of the law is still being debated. Help with drug costs. Medicare offers a program known as Extra Help, or LIS, which we just kind of briefly touched on, for limited income and financial resources. The program is also often referred to LIS, low income subsidy, and can help pay for Part D plan premiums, deductible, co-insurance, and co-payments. This is a fantastic program if you can qualify for it. It can also pay for Part D late enrollment penalties. Generally, individuals with an income limit of $21,870, these are 2024 numbers, which are up, and a resource limit of $16,600, and for couples, those are $29,580, and a resource limit of $33,240, which we'll go into later. Can qualify for LIS Extra Help. Pricing varies based on income level. For more details and how to apply, please refer to medicare.gov/basics/cost/help/drug-costs. The Inflation Reduction Act and LIS. The new prescription drug plan, i.e. the Inflation Reduction Act, will help those who qualify for the Extra Help program even more. In 2024, everybody who qualifies for Extra Help LIS will pay zero Medicare drug plan, monthly premium, zero plan deductible, and reduced amount for prescriptions. These are actually up a little bit, couple, some cents. They were around $4.15 and 23. So these are up, but they're still better than if you didn't get it, because a brand at $11.20, I mean, brands can be $50 higher. Donut holes, you name it, right? So that's a fantastic program. Partial LIS is being phased out on 1/1/24, meaning that full LIS program will be available to everyone. So there's no longer a partial LIS. So anybody under 150% of the poverty level will get the same benefit. Before, it was 135 to 150 was a partial level, so that's gone. What are considered resources for LIS? Money in a checking, savings, or retirement account, stocks and bonds. What are not considered resources for LIS? Your home, one car, burial plots, and up to $1,500 if set aside for burial costs. Furniture and other household and personal items. You can apply at ssa.gov/extra help or call the number. or also more info at medicare.gov/extra help. Help with drug costs continued. So aside from LIS, many states offer state-run programs to assist with higher drug costs. To see what's available, you can check out this article from Medicare.gov.